Then let's review the lymphatics a little. I will be talking about the lymphatics of the head also because I want to cover this whole topic. So, um, the we can talk about when we are talking about the lymph nodes. In the books, different approaches are taken to discuss the different parts. Usually, a regional approach is taken where we talk about the lymphs behind the larynx, behind the pharynx, retropharyngeal, and region wise. And sometimes we talk about the rings, the horizontal rings, the ring that is making on the facial aspect. There is a ring of lymphatics, and there is another ring inside, and there are vertical chains that are deep cervical nodes. We will talk about them. So we will talk about the regional aspect. We will talk about the superficial nodes of the head, deep nodes of the head, superficial nodes of the neck, and deep nodes of the neck. Let's like this is the regional aspect. Let's talk about the lymphatics. First of all, the occipital nodes. These are nodes on the back of the head in the occipital region, and they are on the apex of the posterior triangle. And as you can see, it is receiving the fibers from the back on the back of the head from the vertex, and it itself it drains into the deep group of cervical nodes. Then move on to the retroauricular nodes. These are nodes that are behind the ear, retroauricular. And if you move your finger behind the auricle, you will see that the bone that is present here is mastoid bone. So that is the mastoid group of lymph nodes and retroauricular group of lymph nodes. So they receive the area moving up. So it is draining the area of the scalp that is behind the ear all the way up to its tip of it, and some of the external layer and external meatus is also coming from here, and also drains down to the deep group of cervical lymph nodes. Then we come with the parotid preauricular region. Preauricular parotid nodes, as you can see, the two names, it is preauricular. They are present in front of the ear, preauricular, and they may be present on the top of the parotid gland. So these are parotid or preauricular nodes, and they receive lymphatics from the ear, from the forehead, from the temple region. An easy way to remember is that if you have an idea about this picture, thus horizontal, these lines like this lines, roughly the pathway of the facial artery, like this. So this is defining the area of the parotid nodes. The part lateral to it, it is draining into the parotid nodes. The part medial to this line, it is draining into the submandibular and submental group of nodes. So the area that is lateral to it, it will go to the parotid and preauricular nodes. The part that is medial to it, it will come down and it will drain into the submandibular nodes and submental nodes here. And here 4 teeth, 4 incisors, this area. 4 incisors, they go into the submental nodes, and beyond the 4 incisors, they go into the submandibular nodes. So this is the parotid group of nodes. It is receiving the lateral aspect of the temple, lateral aspect of the orbital cavity, lateral aspect of the forehead, the temple region, and a part of the external auditory meatus, especially the anterior one. And it is itself, it is going and draining into the deep group of deep group of lymph nodes, deep cervical lymph nodes. Then there is a buccal nodes. There is an additional group of nodes right here on your cheek, buccal nodes, and they are close to the facial veins. They drain part of the nose and eyes and the ear that is area that is near to it. It is draining along the facial vein down to the submandibular group of nodes. Then there is submandibular nodes that are present in the submandibular fossa, in the submandibular region, beneath the investing layer. Some are outside it also, and it is shown in both of these picture here. And it is receiving the lymphatics from the buccal nodes. It is receiving from the submental nodes. So everything that was beyond inside this line. So nose complete anterior aspect, upper jaw, lower jaw, and so cheek area. So all of these, and these include the face of the scalp also. So the front of the scalp, nose, external sinuses, upper lip, lower lip, and teeth, all of these are coming into the submandibular group of nodes. Efferent, it going to the deep group of cervical nodes. Then we are left with submental nodes. It is present just in the submental triangle. It is receiving, if you make a triangle from the four incisors to the tip of the tongue, so that triangle, the lip, middle part, four incisors all the way to the tongue. So this floor of the mouth, this is draining into the submental nodes. Most of them, they do drain into the submandibular group of nodes, but some of them, they do go directly into the deep group of cervical nodes also. Then we are left with anterior cervical nodes, not very clearly shown in this very picture. They are placed somewhere here near the anterior jugular nodes, and some of them are in the suprasternal space. Usually, the suprasternal space was the cavity in the investing layer of deep cervical fascia just above the jugular notch, and the infront one goes. They go down to the deep cervical nodes and they go into the prelaryngeal and tracheal nodes. So they are shown here along the running across along the anterior jugular vein. Then there is a retropharyngeal group of nodes. They are present on the back of the pharynx, and the retropharyngeal nodes are present behind the visceral fascia, buccopharyngeal fascia, in front of the prevertebral fascia. And the clinical importance was that the purulent, the infection will lead to the infection of the prevertebral space, and they drain the back aspect of the oral cavity, the back aspect of the nasal cavity, and the pharynx also. Nasal part of the pharynx, soft palate, hard palate, nose, auditory tube, and cervical vertebra. These are drained by this structure. And laryngeal, pre-laryngeal nodes are in front of the larynx, deep to the nesting layer, and deep to the muscles that are covering that are suprahyoid, infrahyoid muscles, and they drain the structures that are indicated by the name, that is larynx, and trachea that is near to it, and they go to the deep cervical nodes. And then we are left with tracheal. The nodes that are anterior to it, that will be pretracheal. The nodes that are lateral to it, that will be paratracheal, and they will be draining structures from the trachea itself and the neighboring structures, and they will drain into the deep group of cervical nodes. This is the whole area. Now let's talk about the vertical groups. There is a superficial and deep. Superficial lymph nodes are present on the outside. They are present on the outside of the sternocleidomastoid. They are present along the external jugular vein, and they drain the area here, right around here, along the angle of the jaw, of the apex of the parotid, lower end of the parotid gland, lower lobe of the ear, floor of the external meatus, and they go and drain into the deep group of inguinal nodes, or not cervical nodes. Sorry, have I been talking about inguinal nodes? Okay, then there is deep group of cervical nodes, and they run along the internal jugular vein, and they run all the way from the base of the skull to the root of the neck, and they are embedded within the carotid sheath. These are one of the contents of the carotid canal, carotid sheath, and they are divided into the upper superior cervical group. They are divided into lower cervical group, and the upper group does contain one important lymph node that is known as jugulo-digastric node, and the lower group contains one important one that is known as jugulo-omohyoid node. So jugulo-digastric one is present in the upper group. It is below the posterior belly of digastric, in front of internal jugular vein, and it's behind the angle of mandible, right somewhere here. So it is the one that is draining the posterior aspect of tongue and tonsils. So it is very important in tongue. And the other one is the jugulo-omohyoid. It is present below, and it is just above the intermediate tendon of omohyoid, just where it crosses this area, and it drains the tongue also. So most of the tongue was drained into here directly. Some of it was going to the jugulo-digastric, but the drainage of the jugulo-digastric does go through the jugulo-omohyoid. So in conclusion, all of the lymphatics of the tongue do go through jugulo-omohyoid node. So this is a very important for tongue, especially in the case of spread of infection and carcinomas. So efferent, that goes to the jugular lymphatic trunk on the right side, jugular lymphatic trunk that will drain to the right lymphatic group on the right side, and the thoracic duct on the left side. Supraclavicular nodes. These are not separate nodes. These are basically the part of the lower group of the deep cervical nodes. These are present into the. They are the ones that go into the posterior triangle of the neck, and these are the ones that are draining the upper limb. Some and upper limb nodes are draining here, and this is the one that is near the accessory spinal accessory nerve that is damaged during its dissection, and they again drain into the jugular group of lymph nodes. These are supraclavicular nodes, and then we are left with termination. On the left side, jugular trunk goes to the thoracic duct. On the right side, it goes into the right lymphatic duct, and they may open independently also. So these are some of the pictures of natter that may help you revise the topic. So this is just a summary slide. I'm not going to talk about it right now. So we'll talk about the lymphatic drainage of each of the structures as we go through them. But this is again a placeholder and notes for you right now. Again, a summarizing slide talking about all of the structures that we have done till just now. You may take a screenshot for it, or simply open and read the books. Okay, this is one thing that I would like to discuss. These are the levels of cervical lymph nodes in dissections. These are the very important in surgery, especially when doing the mastectomies, when doing the surgeries for the breast cancers or other cancers. We talk about which level of lymph nodes are to be divided. So the level one will be the one that are present in the submental area, submandibular area. So basically supraoid region, that is the first level. The second level will be the deep group from the base of the skull to the carotid bifurcation. It will be the level 2. From the carotid bifurcation to the omohyoid intermediate tendon will be the level 3. From the omohyoid tendon to the root of the neck, the clavicle will be the level 4. Posterior triangle of the neck will be included in level 5. Then we are left in midline, pretracheal and prelaryngeal, all of the one that is in the midline, that is level 6. And then the ones that are present right here in the superior mediastinum, that will be level 7. So these are group of superficial cervical lymph nodes. The levels will become important to you when you are talking about different surgeries. For example, in the mastectomies, neck dissection is done. In the classic neck dissection, done. So level 1 to 5 lymph nodes are taken out along with the structures that are surrounding them, that include the sternocleidomastoid, internal jugular vein, accessory nerve. However, to the taking out of these structures, sternocleidomastoid, internal jugular vein, and accessory nerve, they give some serious disabilities. So there is modified and radical neck dissection, that is functional neck dissection. So you try to save all or some of these structures as well as you can, so that the person may not have hampering of the functions due to it. Then the selective neck dissection is dissection smaller than that will be selective neck dissection. It will be defined accordingly of which nodes are you going to extract exactly. So this is all about the lymphatics. The last topic for today, the viscera, the thyroid gland, and the parathyroid gland. Let's take a 1 minute, 2 minute break, and then we will move on to the thyroid gland and finish the lecture.